We are often asked how people can reduce the risk of developing Alzheimer's and related disorders. While we don't know of any method that absolutely prevents Alzheimer's from developing, that is, to guarantee that an individual will never develop Alzheimer's or a similar disorder, there are ways to improve the chances of the brain remaining healthy as someone gets older. By following these recommendations, it's been estimated that up to 40% or maybe more of Alzheimer's cases could be prevented. These recommendations do not include any particular supplements or herbs or vitamins, but rather the good health habits that most physicians should be recommending to their patients regardless of their concern for brain aging. For example, physical exercise, at least weekly moderate to vigorous exercise, may reduce dementia risk over 10 to 25 years of follow-up. This usually involves cardiovascular exercise, something that gets the heart rate going, roughly up to 70% of its maximum, provided, of course, that there's no medical reason why that exercise could be dangerous. Some patients are concerned about limitations caused by pain, such as arthritis. In this case, there are still options. Think about a swimming pool or stationary bike, for example. We also recommend a healthy diet. The best evidence seems to be for a modified Mediterranean-style diet, sometimes referred to as the MIND diet. This involves high fruit and vegetable intake, with whole grains, low-fat milk, and relatively little red meat, using margarine or rapeseed oil instead of butter, as well as generous portions of fish. We recommend against excessive alcohol intake. The risk between heavy alcohol use and dementia has been recognized for centuries, and may be especially clear in younger onset dementias. Data varies on whether mild alcohol intake may be protective, but we would certainly caution against using this as an excuse to intake alcohol excessively. Attention to diet will also reduce the risk of obesity and diabetes. Both obesity and diabetes have also been found to increase the risk of dementia. High blood pressure has also been associated with an increased risk of dementia, particularly blood pressure that is elevated throughout midlife. Blood pressure declines in later life may be associated with or potentially cause dementia. So we are cautious about how we manage blood pressure later in life. If there is any question, work with a primary care provider to help manage high blood pressure or risk for diabetes. Smoking also increases dementia risk. However, if you stop smoking for, say, more than 4 years, that dementia risk is substantially reduced. Even secondhand smoke may increase the risk of developing dementia. Perhaps related to this, air pollution generally has been associated with a dementia risk. This especially involves high nitrogen oxide and particulate matter, such as that caused by traffic exhaust or wood burning. Carbon monoxide is also associated with an increased risk of dementia. We also recommend that people be tested for hearing loss with appropriate screening, and that any hearing loss be treated with hearing aids. Midlife hearing impairment has been associated with steeper loss in areas of the brain affected by Alzheimer's disease, such as the hippocampus. Hearing aids may be protective against that cognitive loss, perhaps by allowing more cognitive stimulation. We recommend cognitive activity throughout the entire lifespan. Small studies have suggested that travel, playing music, reading, speaking a second language, and more have been associated with maintaining cognition. A higher level of education is also protective against later dementia development. We recommend frequent cognitive activity. There's not a lot of evidence that compares one method against another, but it should be something active, not just, for example, watching an educational program or sitting in a class, but something that actively challenges the brain. Checkers, chess, crosswords, Sudoku, learning a language, dedicated computer games, and so on. We also recommend high-quality sleep to help guard against dementia. Sleep may lower dementia risk through a variety of mechanisms, including clearing amyloid, one of the proteins that misfolds and is deposited on the brain in Alzheimer's disease. Sleep is also associated with reduced inflammation and reduced risk of cerebrovascular disease. Sleep can be disrupted, however, by insomnia, apnea, as well as other things. Sleep medications, such as benzodiazepines, can also sometimes increase the risk of dementia. We also recommend that people pay close attention to their mood. There has been an increased risk of dementia associated with depression. Furthermore, depression may sometimes be an early sign of dementia. If there is a mood disorder such as anxiety or depression, it's important to not just ignore these symptoms, but rather seek the help that's necessary. There's also increasing evidence that traumatic brain injury, from mild to severe, can increase the risk of dementia. Risk increases with the severity of the traumatic brain injury as well as the number of injuries. Traumatic brain injury contributes both to the risk of Alzheimer's disease and other dementias like chronic traumatic encephalopathy or CTE. While there is no absolute guarantee against Alzheimer's in later life, the steps that we have outlined here do improve the chances of growing older with a healthy brain. You can work with medical providers, including your primary care provider, to find ways to make these recommendations work best for you.